As a home care provider, you're called upon to perform a wide variety of tasks in a wide variety of settings. Yet, whatever your duties, you have an important responsibility to protect your health and the health of your patients. One of the most difficult challenges you face in meeting that responsibility is the danger posed by bloodborne pathogens. Because they can be passed from person to person, bloodborne pathogens have the potential to harm you, your loved ones, and your patients. What are bloodborne pathogens? How can they put your health and your patient's health at risk? Most importantly, how can you protect yourself, your patients, and others? In this video, we'll answer those questions. You'll learn what bloodborne pathogens are and what diseases they can cause. You'll see how pathogens can be transmitted and learn about universal precautions and infection control principles, ways you can protect yourself and your family, as well as your patients and their loved ones. You'll also see home health workers, like yourself, and how they protect themselves and others from the dangers of bloodborne pathogens. And you'll see what can be done when exposure to bloodborne pathogens does occur. Let's begin by defining what bloodborne pathogens really are. Pathogens are disease-causing microorganisms that are carried in the human body. Bloodborne pathogens are present in the blood and blood products and other body fluids, including semen, cerebrospinal fluid, synovial fluid, pericardial fluid, amniotic fluid, and vaginal drainage. Bloodborne pathogens can also be found in other body fluids if they are visibly contaminated with blood. These fluids include urine, stool, emesis, saliva, sputum, and wound drainage. The pathogens can be transmitted through contact with blood or body fluids in a healthcare setting by needle sticks, through breaks in the skin, or through splashes into the mouth, nose, or eyes. Pathogens can also be spread by sexual contact and by sharing needles. During pregnancy, pathogens can be transmitted from mother to fetus. The diseases that can be spread by bloodborne pathogens include hepatitis B, also known as HBV, hepatitis C and D, and human immunodeficiency virus, HIV, the pathogen that causes AIDS. The most significant and worrisome bloodborne diseases are hepatitis B and HIV. In 1987, the Centers for Disease Control and Prevention developed universal precautions, also called standard precautions. Healthcare workers should follow these measures to prevent contact with blood and certain body fluids. You may also hear the term body substance isolation, which covers many of the concepts of universal precautions. Three guiding principles form the philosophy for universal precautions. First, because all persons are potentially infectious, you must take necessary precautions as if they were infectious. Second, treat all body fluids as infectious, regardless of type or source. And third, handle all used needles and sharps as if they are infectious. Although universal precautions were designed primarily for healthcare workers, they should be followed by anyone who comes in contact with a patient. This includes doctors, nurses, therapists, social workers, home health aides, other members of the home care team who work with patients, and even family members. Following universal precautions can present some unique challenges in the home setting. Sometimes it may seem easier just to skip a step here or there. Yet for your safety and your patient's safety, it's vital that you follow these steps for preventing the spread of bloodborne pathogens. Hand washing is the single most important defense against disease. To protect yourself and your patients, always follow the proper procedure. Always carry your own hand washing supplies, including soap and towels. Liquid soap is best. Moist bar soap stored in a container creates a breeding ground for bacteria. Even if most of your patients' homes have running water, you should also carry a supply of antiseptic towelettes or gel just in case. First, wet your hands with warm water and apply soap. Lather well and vigorously wash all surfaces, including the backs of your hands, your wrists, between your fingers, and under your fingernails for at least 10 seconds. Wash 10 seconds longer if you've had contact with potentially infectious material, like wound drainage. Remember, it's the friction that does the cleaning. Rinse your hands under running water and dry your hands thoroughly using a single-use towel. Finally, turn off the faucet using a clean, dry paper towel to avoid contaminating your clean hands. It's important to wash your hands before and after every patient contact, but there are other times equally as important. You should always wash your hands before and after patient care, after any contact with contaminated objects, after handling waste material, secretions, drainage, or blood, after caring for personal needs, such as blowing your nose, covering a sneeze, combing your hair, or using the toilet, before eating, drinking, handling, or serving food, and before and after each work shift. During your visits, you may need to use some of the personal protective equipment, PPE for short, to help you observe universal precautions. PPE is designed to create a barrier between you and the patient and prevent the spread of bloodborne pathogens. We're going to look at 4 types of PPE: gloves, garments such as gowns and aprons, eyewear, and masks. Let's begin with gloves. Put gloves on before any patient procedure that could put you in contact with blood, body fluids that contain blood, or skin that is open or cut. Wear gloves for cleaning spills or handling supplies, utensils, or linen soiled with blood or body fluids. Change gloves between each patient procedure, especially when moving from a dirtier procedure to a cleaner one. And wash your hands between each glove change. There are 3 types of gloves to choose from, depending on your assignment: sterile gloves, non-sterile gloves, and utility gloves. Wear sterile gloves when working within a sterile field, performing procedures that require sterile supplies, such as catheterization or certain types of wound care. We'll show you how to put on sterile gloves a little bit later in this program. Wear non-sterile gloves for any clinical procedure which could expose you to blood or other body fluids, for example during venipuncture, oral hygiene, or perineal care. Before putting on gloves, remove any rings that could puncture the gloves. Wash your hands and dry them thoroughly. Be careful not to tear the gloves when putting them on, and inspect them carefully to be sure there are no holes or tears. To remove sterile or non-sterile gloves after use, grasp the cuff of the left glove with your right gloved hand and pull, turning the glove inside out. Hold that glove in your right hand. With your ungloved left hand, grasp the inner right glove at the top near the cuff, where it's considered to be cleanest. Peel it off turning it inside out over the other glove, and throw them into a plastic-lined trash receptacle. Then wash your hands. The third glove type is utility gloves, also known as kitchen gloves. Use these only to clean equipment, your work area, or spills. After each use, examine utility gloves for punctures or signs of deterioration, such as cracking, peeling, or tearing. If necessary, dispose of and replace these gloves. Clean undamaged utility gloves by washing them with detergent and water. Remove and place them to dry. Besides gloves, you may wear personal protective equipment such as aprons, gowns, goggles, and masks to protect you from becoming contaminated with blood or other body fluids. Personal protective garments like gowns cover your clothing. They should be moisture-proof and disposable. After use, remove and discard gloves. Then carefully remove the gown. Avoid touching the contaminated surface. Roll the gown into a ball with the contaminated surface inside. Dispose of the gown in a plastic trash bag in the work area and wash your hands. We'll demonstrate use of a disposable apron in a few minutes. Use disposable face masks whenever you might reasonably expect that blood or other body fluids could be splattered and aerosolized, that is, transmitted through the air, as in a cough. Use an individual mask only once. On occasion, you may use a disposable CPR mask when it's necessary to provide artificial mouth-to-mouth or mouth-to-stoma ventilation. Discard all disposable masks in a plastic trash bag in the patient's home. Wear goggles or safety glasses with side shields when there's a potential for blood or other body fluids to splatter into your eyes, for example, during wound irrigation. Clean goggles with soap and water after each use. If spattered with blood, use ethyl alcohol or a chlorine compound. If goggles crack or become heavily contaminated, discard them in a plastic trash bag in the patient's home. Now that we've looked at personal protective equipment, we'll see how two home health workers from one agency, a nurse and a home health aide, use universal precautions in their day-to-day patient care. You'll find that following the correct procedures isn't really that difficult after all. Meet Tricia Walker and Robin Evans. Tricia is a nurse who's been with this agency for 5 years, and Robin is an experienced home health aide. Today, Robin and Tricia will each visit Mrs. Clark, although they'll visit at different times. Mrs. Clark was recently in an auto accident that left her with a sprained wrist, a dislocated shoulder, many bruises, and a number of cuts, some serious enough to require dressings. Mrs. Clark is also a diabetic who requires regular injections of insulin. She needs help with the injections because of the injuries she sustained. Tricia will visit Mrs. Clark first, but her preparation begins long before she arrives at her patient's home. Plan ahead. Know what supplies you'll need for your visit and pack your nursing bag with those items. Keep clean supplies like dressings and gloves separate from things like the blood pressure cuff and stethoscope. and place your hand washing supplies at the top of the bag for easy access. In your car, carry a supply of fresh newspapers to use as a barrier between your equipment and the home environment. And don't forget some plastic trash bags for disposing of contaminated waste. Now that we've learned about personal protective equipment, we're ready to watch Tricia as she visits Mrs. Clark.
Mrs. Clark, it's good to see you. How are you feeling today?
Actually, I'm feeling better this morning, but I'm still having difficulty getting around, and these dressings are bothering me today.
I'll get my things ready and then we'll get right to work.
Okay.
Is it okay if I use that table?
Sure.
Inside the home, Tricia's first step is to set up her nursing bag so that both the bag and its contents won't be contaminated. She selects a clean, convenient spot that's safely out of reach of any children or animals in the home and close to her work area. She spreads a clean barrier and places her nursing bag on it. From her nursing bag, Tricia removes the soap and paper towels and washes her hands.
I'll be right back.
Then she removes all the supplies she'll need for this visit and closes the bag to prevent contamination. It's important to go in and out of your bag as little as possible and to keep your bag closed between uses. Other important tips to remember about the nursing bag. Try to keep it close to you at all times. Consider the bag to be a clean piece of equipment. Do not place it on the floor. That means you should clean potentially contaminated equipment, such as the stethoscope, before putting it back in the bag. And never carry contaminated dressings, needles, or supplies in the nursing bag.
I'll give you the insulin injection first, and then we'll do your dressing changes.
You'll probably have to administer the shot in my abdomen today.
Okay.
To dispose of contaminated syringes and other sharps, use a sharps container. It should be puncture and leak-proof, red in color, and preferably labeled with a biohazard symbol. It is a good idea to carry a sharps container in your car, just in case the patient does not have one. In the home, store sharps containers in a safe place, out of the reach of children and animals. To prevent accidental contamination, never fill sharps containers more than 2/3 full. When full, carefully seal the top of the container with tape, taking care not to run your hand over the opening. Your agency's policy may instruct you to bring full sharps containers back to the agency for commercial waste disposal pickup. In the event that your agency policy or local ordinances dictate otherwise, find out what to do with full containers. Tricia disposes of a used syringe in the sharps container. When disposing of sharps, do not recap the syringe. Never break the needle from the syringe. Always dispose of it in one piece. Now we'll learn about the use of sterile gloves and supplies as Tricia changes the dressing on Mrs. Clark's leg. In preparation for this procedure, Tricia helps Mrs. Clark move into a comfortable position, with the wound easily accessible. Tricia lines a waste receptacle with a plastic trash bag. If a receptacle is not available, set out an open trash bag. She washes her hands again to begin the procedure and puts on appropriate personal protective equipment. In this case, Tricia will wear a plastic disposable apron and non-sterile gloves to remove the soiled dressing. It is not always necessary to wear a gown or apron to remove a soiled dressing. Base your decision on the location and condition of the wound. Tricia removes the soiled dressing and discards it in the waste receptacle. She then removes her gloves, following the procedure we demonstrated, and discards them. The next step? You guessed it. Tricia washes her hands, and she's ready to proceed with the wound care. In Mrs. Clark's case, that means using sterile supplies to minimize the possibility of contamination of the wound by pathogens. The wound care kit for Mrs. Clark includes sterile gloves and dressings. No matter how sterile supplies are packaged or arranged, you must follow certain principles to prevent contamination. Place a clean towel, if available, in the working area to minimize contamination. Open the package carefully, peeling the outward non-sterile covering away from the inside sterile portion. Using the non-dominant hand, grasp the sterile glove by its inside cuff. Do not touch the outside of the glove. Slide the dominant hand into the sterile glove, and then, with that sterile gloved hand, pick up the other glove and put it on. Adjust the fit, using fingers as necessary. This way, nothing is contaminated. If at any time gloves are contaminated, remove them and begin again with a new pair. Tricia performs the wound care procedure following the physician's orders and agency procedures. As she cares for the wound, Tricia handles sterile supplies carefully to avoid contamination. She is careful not to touch anything outside the working area. After cleansing the wound, Tricia applies a new dressing. When she's finished, Tricia removes her gloves, turning them inside out, and discards the gloves. To remove the apron, Tricia grabs it from the inside, pulls down, rolls it into a bundle with the contaminated side in, and discards it in the trash along with any other waste. Next, she acts to protect herself and her patient by once again washing her hands. You'll follow these same infection control principles when you insert an indwelling catheter, care for a central line, or perform other procedures requiring the use of sterile supplies. As Tricia winds up her visit, she's careful to clean up properly. She gathers up any remaining disposable supplies, places them in the waste receptacle, and closes the bag. To ensure proper disposal, she places the closed bag in the family trash bag. She washes her hands thoroughly. Puts away her hand-washing supplies, and closes and fastens her nursing bag. Now let's move on to later the same day and observe Robin, the home health aide, during her visit with Mrs. Clark. Robin has checked the assignment, planned her duties with the patient, washed her hands, and is ready to go.
I really wish I was stronger so I didn't need help doing simple things, like getting to the bathroom.
You're getting stronger every day. I'll give you some privacy while I'm outside changing the sheets on your bed.
Since the bed linen could be contaminated, Robin wears non-sterile, disposable gloves to perform this task. Robin removes the linens carefully, watching for sharps such as needles or syringes, which could be hidden in the bedclothes. She handles the linens carefully, rolling them into a ball and carrying them away from her body. She puts the dirty linens in a separate plastic bag to prevent leakage or soak-through, closing it securely. Never mix these linens with the family laundry. Never put linens or the plastic container on the floor. Robin removes her gloves and washes her hands before putting clean linens on the bed.
I'm ready for you to help me brush my teeth.
I'll be right there, Mrs. Clark.
It's not something I enjoy having someone help me brush my teeth, but I really do appreciate your help.
Since performing an oral hygiene procedure has the potential to put Robin at risk through exposure to body fluids, she washes her hands and puts on a clean pair of non-sterile gloves. Robin helps Mrs. Clark brush her teeth. Disposes of her gloves. Washes her hands. And then helps Mrs. Clark return to bed for her partial bath. After finishing care, Robin closes the trash bag containing her used gloves. She places this bag in the plastic trash bag in Mrs. Clark's kitchen. She's careful never to push down on the trash, which could contain hidden sharps. Robin used non-sterile gloves and universal precautions to assist her patient with oral hygiene. You will use these techniques to protect yourself from exposure when you assist your patient with toileting, using the bedpan or urinal, performing nasal suctioning, or caring for a catheter drainage bag and other procedures. Finally, Robin washes her hands before leaving to visit her next patient. In the case of Mrs. Clark, neither Tricia nor Robin used all of the equipment in their bags. Know your agency's procedures for handling your equipment. Here are some equipment handling tips. Thoroughly examine all your equipment to make sure it's clean before every use. Wipe your stethoscope with alcohol or another approved disinfectant after each use. Spray or wipe the blood pressure cuff, following your agency's policy. You'll use a chemical germicide approved by your agency as a disinfectant. Products registered by the EPA with an accepted HIV label are effective against HIV contamination. For protection, all patients should use their own thermometers. Wipe mercury thermometers with alcohol and return them to their storage containers after each use. When you use a digital thermometer with a disposable sheath, wipe the thermometer with alcohol after you've removed the sheath. Whenever possible, use the patient's own nail clippers. If you must use your set, disinfect with alcohol, a 1 to 10 bleach solution, or an approved disinfectant between patients. Besides taking care of individual pieces of equipment, regularly clean and disinfect your bag according to your agency's policy and procedure. You may need to decontaminate spills of blood or body fluids in the home. Household bleach is cited as the all-purpose disinfectant for blood and body fluid spills and contamination. For decontamination of spills at a patient's home, wear utility gloves to protect your hands from harsh chemicals. When cleaning up a blood or body fluid spill, dilute household bleach 1 to 10 parts with water. Mix a fresh supply of bleach each day. Because bleach corrodes metal, you can also use a chemical germicide approved by your agency as a disinfectant. There's one more important area to consider, and that is collecting samples or specimens such as blood, stool, urine, sputum, or drainage. No matter the type of specimen you handle, proper hand washing techniques and gloves are a must. Depending on the situation, additional personal protective equipment may be necessary. Collect specimens in the appropriate container, according to your agency's procedure. Label specimens with the patient's name and any other identification needed. Place the specimen in a leak-proof bag, preferably a biohazard bag with a sealing lock. And secure it in a puncture-proof container. Handle specimens carefully to minimize spills. Transport the specimen according to your agency's policy. If you use your car for transport, put the puncture-proof container on the floor or in the trunk. Your agency's policy may require you to use a courier service. Following the examples of Robin and Tricia, as well as the procedures we've discussed in this section, will help protect you and your patients from bloodborne pathogens. But what if an exposure does occur? We'll look at that next. OSHA has created detailed standards for exposure to bloodborne pathogens, which apply to home health agencies. OSHA requires that each agency develop a written exposure control plan, which includes a list of high-risk job classifications, tasks, and procedures, procedures for evaluating exposure incidents, and documented evidence of a periodic review of the plan at least once a year. In addition, home health agencies must offer hepatitis B vaccine to all at-risk employees who have not been previously vaccinated at no cost to the employee. To fully protect employees and patients, home health agencies should also have written policies and procedures for how to report exposure incidents, who to contact regarding exposures and questions, how to handle emergencies involving bloodborne pathogens, and provisions for post-exposure evaluation and follow-up. Exposure means you have come in contact with blood or other potentially infectious body fluids that can enter your bloodstream through chapped or broken skin, open wounds, or mucous membranes, including the eyes, nose, and mouth, or through a needle stick or puncture with blood-contaminated instruments. Exposure incidents can lead to infection from HBV, HIV, or other bloodborne pathogens. However, there are steps you can take to protect yourself when an exposure occurs. Acting quickly can reduce your risk of infection. It is essential that every home care worker know how to cleanse the area thoroughly before reporting to the supervisor or filling out a form. In the case of a needle stick, puncture, or scratch, immediately squeeze the area to induce bleeding. Cleanse the wound thoroughly with soap and water. Then further cleanse it with betadine solution or alcohol. You can pack betadine or alcohol wipes in your nursing bag. Save any sharps or other items involved for further testing. Use a puncture-proof container for transport, such as an empty coffee can or plastic food storage container with a lid. If the exposure occurred to your skin, immediately wash the affected area with soap and water. If mucous membranes, such as your eyes, were exposed, vigorously irrigate the area with large amounts of water for at least 5 minutes. Your next step should be to report the incident to your supervisor or agency infection control representative. Report needle sticks or other cuts or punctures, splashing of blood or other body fluids into your mouth, eyes, or nose, and direct or prolonged contact with a large amount of blood or other potentially infectious fluid. It's estimated that almost 1/3 of all healthcare workers ignore needle sticks when they occur, yet these exposures shouldn't be casually dismissed. Failure to report a needle stick could keep you from receiving important follow-up medical attention. It also could prevent you from collecting compensation if you did contract an illness from the contaminated needle or exposure incident. And most importantly, you could put your life and the lives of your loved ones and patients at risk. Once your report has been made, you'll also need some follow-up testing and treatment. If you've been exposed to HBV but have never been vaccinated prior to your exposure, your follow-up treatment should include a hepatitis B vaccination as soon as possible following the incident, with follow-up injections in 1 month and again 6 months later. If you've been exposed to HIV, your follow-up care will include testing and recommendations on medication that may be effective in treating your exposure. Bloodborne pathogens are a leading source of disease today. As a home care provider, you play a vital and sometimes challenging role in protecting yourself, your patients, and others from these pathogens. Be alert to the risks of bloodborne pathogens. Practice universal precautions, hand washing, and effective procedures for preventing the spread of disease.